Welcome, welcome. I think we'll give folks about another minute to join us, and then we're going to get started as we're seeing people come in. Thanks for being here. If your name isn't updated to say your name, sometimes when we're facilitating, we have something else. Feel free to rename yourself. If you want to include pronouns, you use them. We invite you to do that. And if you want to include where you're located, it's always fun to see where people are joining us from. So feel free to do that. And because we have a lot to cover today, we're going to jump right in. And as I said, welcome. We're so pleased to welcome you to this third in a series of free introductory virtual workshops about causal pathways. Today's session is focused on the nitty-gritty of a causal pathways evaluation, design, and implementation. And we're glad that you want to dig into the nitty-gritty with us. This session is being hosted by the Causal Pathways Initiative. We are an international network of evaluators, methodologists, philanthropic leaders, and others. Our aim is to build awareness, will, and skills among philanthropy funders and evaluation partners so that we use evaluation approaches that can make sense of causal relationships without depending on more traditional experimental and quasi-experimental approaches. This is because we know that many funders are interested in systems change strategies, but it seems many fewer are fully aware that there are methodologies that can help them understand if systems are or are not changing and under what conditions that's happening. So my name is Allison Gold. I will be one of your three co-trainers today. I'm the founder of a firm called Optimistic Anthropology, and it's based between Washington, D.C. and Sarajevo in Bosnia-Herzegovina. I work with organizations and partnerships and communities who share the belief that when we collaborate and learn together, we are able to bring a more just and positive world into being. And prior to becoming a consultant, I spent over 15 years working in nonprofits and philanthropy and government. I am newer to the causal pathways work. I got involved with the initiative about 2 years ago, and I am continuing to deepen my own practice and learn from more experienced colleagues like my co-trainers today. So with that, I'd love for them to introduce themselves. And Steve, why don't you get us started?
Yeah, hi, thanks, Alison, and very pleased to meet you through this initiative and all the other people who've got the pleasure to have in the participant list today. Yeah, I'm Steve Powell. I'm based in the UK, where I was born. I was a psychologist and then I became an evaluator. I worked most of my professional life out of the Balkans, but also in quite a lot of other countries, international development and also humanitarian work. I became very interested in causal pathways and causal mapping and set up Causal Map Limited, where we produce software to help evaluators and other researchers do causal mapping. And that also comes out of an encounter I had with James Copestake and Fiona Remnant in Bath. And so over to you, Fiona.
Thanks, Steve. Hi, everyone. It's a pleasure to be here today. I run a very small non-profit consultancy called Bath Social and Development Research Limited, and we are based in the city of Bath in the UK, also in the southwest. I come from a background of communicating research to practice and policy, but I ended up working on a research project to develop a new evaluation protocol, which came to be known as the QIP, the Qualitative Impact Protocol. And so I've been working for the last 15 years on qualitative evaluations. And so it's been great to connect with this wider causal pathways movement, meet other people who are doing similar things in a similar space in different places. A lot of our work has been in the international development space. So I've done evaluations in more than 30 countries around the world, as well as some national country evaluations in the UK. And as Steve said, we work very closely with him to develop the Causal Map software. which is a part of how we deliver the QUIP evaluations.
Thanks so much, Fiona. And we also would like to introduce the fourth member of our team today, who is Carolina de la Rosa Mateo. You've probably seen her face or at least her emails. So she's the project manager for the Causal Pathways Initiative. And today's session, she's here to help us and you with any tech-related questions or issues that pop up. So thanks so much, Carolina. And now that you know who we are and that amongst us, you know, Fiona and Steve have deep practice in causal pathways related evaluation, I'm more of a newbie. We would love to know a little bit about you. So we have just launched a poll to get a sense of who is in the room today. And in this, we'd like to know what kind of organization you're working in, your primary role, the level of experience you have with causal pathways evaluations. And then we know that there have been 2 earlier intro workshops in this series, and just want to get a sense if folks have attended one, the other, both, or none of them. Or you didn't have to attend live. There are recordings available. So we'll just give folks a second to fill these out. And then we'll start to get some data that pops up about it. All right, so I'm seeing that about 50% of folks are in the nonprofit sector. About 71% of the folks who are joining us today, their primary roles are evaluators. And it seems like we're orienting towards about a quarter of folks are new to causal pathways, 40% have learned some about it, but you haven't conducted one, and another 30% have some experience. And we have a nice mix. Oh, 40% of folks attended or watched both session 1 and 2. That's fantastic. Thrilled to hear that. If you haven't had the chance yet, we really recommend it. Our colleagues, Heather and Kimberlyn for the first session and Drew and Flo for the second session have so much great information that we will not go into depth on today. So fantastic. Thanks so much for sharing that with all of us, folks. We're going to continue through our agenda. So just want to orient you to our agenda for today. We're so glad that you chose to spend time together with us and with this important topic. 3 points that we want to share to get us started is that this is the first time that Fiona, Steve, and I have done this training together. We are constantly looking to improve the trainings that are being offered through the Causal Pathways Initiative. So we really welcome your feedback on the training, and there will be a short survey at the end of today's session. So we hope you'll fill that out. We will have time for Q&A today. However, please put your questions in the chat as we go along. Some of them, if there's a quick answer, we'll try and answer as we go throughout the session. But if it's a longer conversation, we might hold it to that Q&A session at the end. And we know we won't be able to cover everything. So if there's like some big lingering good ones, we'll try and cover them in our follow-up email to y'all. And the third thing I want you to know is materials from today will be available after the session. So our slides, as well as the recording of today's session. So, you know, we welcome you to take screenshots and things like that, but please know you don't have to furiously scramble to capture everything that we're saying. In terms of this session, it is designed as an introduction to key concepts that you can bring into your own practice. Our focus is going to be on building your knowledge of how to design and implement a causal pathways evaluation. And we're going to talk about causal questions, bringing together multiple methods, and doing analysis with a causal lens. But please know that you won't leave this session with a new evaluation design. However, we will connect you to resources that hopefully can get you to be able to create one within your own work. And in addition to sharing what today's learning objectives are, we also wanted to be upfront about what we're not covering or covering particularly deeply today. So we're not going to cover the comparison between causal pathways evaluation and descriptive or purely quantitative approaches, and we're also not going to go too in depth into topics that were covered in the two other workshops. So that is why do a causal pathways evaluation, as well as values, rigor, and quality practices and participatory practices. We really do encourage you to check out those other workshop sessions if you haven't already. And I think Fiona put in the chat a link where you can get the slides and the recordings of those sessions that our colleagues did. So with that, I think we're oriented. It's time to move I mentioned that we're not going to cover in depth the things that our colleagues covered in the other sessions, but we do want to just touch upon them very briefly and reground you in some core concepts. And so I want to start by saying in their work, our colleagues Julia Lin and Marina Apgar write about readiness for undertaking causal pathways work. And they describe this as having a couple of key components. The first, and you'll see this in the lower left of this, is we are asking how, why, and for whom a change is taking place, and in what context is that happening. This is different than asking, did we achieve our outcomes or what outcomes emerged? Instead of being laser focused on what happened, we're asking, why did changes happen? And if this happens differently in different contexts and for different people. And by the way, when I use that term we, I'm not just talking about evaluators or the staff of a funding organization. I'm talking about a larger we that includes partners who are doing this work on the ground, people engaged in systems change, and people closest to the issues or the impacts of a system as well. When we say we, the aperture can be very wide. Readiness for causal pathways evaluation also means we are open to challenging our assumptions about how change happens, and that we are interested in emergent outcomes, whether positive or negative. And so when those orientations are present, we are then demonstrating an openness to learning, which is great. But it's important that this is not learning for learning's sake. Causal pathways evaluation becomes powerful when this work is not an exercise in and of itself, but rather what we are learning has a clear use that improves strategy and moves us closer to the systems we are seeking to bring into being in this world. And in the previous trainings, our colleagues also talked about the importance of causal pathways evaluations being grounded in our values. This is because our values inform and shape our areas of curiosity, the questions we ask, and the approaches and methods we use to apply them, as well as the data sources we deem important. Our values also inform who's included as an evaluation decision maker, and those folks determine the scope, the questions, the design, and the implementation. All in all, our values inform how to plan and conduct a causal pathways evaluation throughout all of its stages. And you can see sort of a description of those stages in the arrowed image at the bottom of this slide. And while we present that image in a way that looks a little bit sequential, most, if not all, causal pathways evaluations do not design all elements of the evaluation up front, but rather make choices about the methods and how to implement them as initial findings emerge. This flexibility and iterative process is critical for understanding how change happens. And the values we use in the causal pathways work are informed by the inclusive rigor framework. So these values include seeking equity and recognizing participatory processes will increase the rigor of causal findings, informing strategy with a focus on the types of learning spaces we need to create, and embracing complexity, including doing this by combining methods, which is sometimes referred to as bricolage. While the Seeking Equity and Informing Strategy work were focused on the previous two intro workshops in this series, Embracing Complexity is very much the focus of today's training. So having briefly connected the dots between that last content, I'm going to hand things over to Fiona to introduce our case for today.
Thank you, Alison. So before we move into the content, I'm just going to briefly introduce the specific example that we're going to be referring to throughout the case study, the session today. So if you could put the next slide up, Alison, thank you. So this is based on an evaluation that me and my team conducted last year. And this was for Save the Children, who we were contracted by. It's a project called Maziko, which means foundation in Chichewa in Malawi. It's a 5-year project that integrates maternal and child grants, so cash transfers made to mothers with young children in the household, alongside a package of government recommended social and behaviour change interventions, which are aimed at improving child nutrition and development. So this started in 2021 and aims to reach around 42,000 households with pregnant women or children under 5 in 2 districts in Malawi. So it's a pilot programme. And these QR codes are repeated on the next slide. So if we just move to the next slide, those will take you to the full report that we did and the learning brief that Save the Children provided. These will be in the notes as well. So this was a pilot programme with the aim of providing the interested stakeholders, that's the government of Malawi, Save the Children, Give Directly, who facilitated the cash transfers, and IFPRI, who are conducting the randomised controlled trial, with the information that they need to be able to scale this up nationally. So the government's very closely involved with this because it needs to inform their social protection system and how they're going to address their multi-sector nutrition strategy. So the evaluation component of this project incorporates a randomised controlled trial and a process evaluation and a qualitative evaluation at midterm. And today I'm going to talk to you about the midterm qualitative evaluation, where we used the approach that I briefly mentioned earlier, which is called QIP, Qualitative Impact Protocol, and causal mapping. These are part of the family of methods that we talk about in causal pathways, and we're going to use this approach as our main case study today, but we'll touch upon some of the others. We're going to talk about use of in-depth individual interviews and focus groups. In this case, it was with mothers of young children, and that was designed to help us understand the changes that they've experienced and how they would describe the causal pathways related to that change. So obviously in this context, these stories of change are complemented by the additional information that we have from the quantitative survey in the RCT and the process evaluation, and that all helps to triangulate the findings. The little diagram you see on the left is a very simple theory of change that just gives you a very brief overview of the basic assumptions that are being made here about use of cash to buy more and better food, and then all the plus aspects of this intervention, which run alongside giving cash, which are around providing training on nutrition and parenting skills, as well as some work with fathers on chore sharing and more involvement with childcare. So this is what's known as a cash plus intervention, and this is complex. There are many different things involved, so we need to understand which parts of this programme are working better than others and which bits will inform the ultimate scaling up strategy. Next slide. So some of you might think, wow, this is like nothing to do with my day-to-day work, but we're confident that the principles that we talk about can be applied. We have done evaluations across a range of sectors, and you can see them listed there in many different thematic contexts, many different countries, but also at different levels. So today I'm talking about interviews that we conducted in households at household level, but we can apply these principles, and we have, when speaking to policymakers, civil society organisers, people working for NGOs. So, you know, just think about how this applies within your own context, and you will be given the opportunity to think and discuss that in a breakout room later. I'm going to pass back to Steve, I think.
No, is that my slide? Good. So when you're planning a causal pathways evaluation, because you've looked back at Alison's slide and decided, yes, I do want to, or we do want to know about how change happens and why it happens in different contexts for different people, or how it doesn't happen, then normally you're going to combine multiple methods. You're going to engage voices in multiple ways, different voices, and you're normally going to visualize different kind of routes through causal routes through a network, like how does change possibly come arise, or at least what are stakeholders' opinions or views on how changes can arise. So how do you do that? And it's quite a big ask. You kind of think, oh, I wish I had a simple method like 1, 2, 3 that will do all of this for me. And well, there isn't really for any kind of evaluation, I don't think, and there isn't really for a causal pathways evaluation either. But if you could do the next slide, here we go. Yes. So this on the left, you'll see there's this kind of colored bar. And as we go through most of the rest of the slides, you'll see that they correspond to these 4 sections, which we repeated again in black and white in the middle. So these 4 sections, this is kind of an overview of the 4 sections that will take most of the rest of the workshop today. The first part is about design and questions. It's really, I guess, the most important part is what are you trying to find out? And are you trying to find out something that's essentially and fundamentally causal? If you're simply trying to illustrate, a lot of philanthropic work, people in the past have maybe just kind of illustrated or described what's going on, which is not a bad thing to do. But if you're more specifically interested in like why and how change is happening or not happening, then you're probably going to want to go a bit further than that. So you're going to want to design a causal pathways type evaluation. In terms of methods, again, there isn't like a simple sort of flowchart or spreadsheet where you can where you can say, oh, I want to find this out, so I have to use method X. Unfortunately, that doesn't really exist. And in any case, you'll probably be combining methods, probably a couple of different methods at least, as well as simply your kind of background being an evaluator and thinking about stuff and talking to people and being in touch. Apart from perhaps just key stakeholder interviews, all these kinds of things which are perhaps above and beyond or beneath and below more specific methods that have titles to them. And a modern way to talk about how we combine these different methods that's current at the moment is bricolage. So the idea that we can kind of mix and match, and not only mix and match whole methods, but also mix and match parts of methods. So you might say, oh, I like this step in outcome harvesting, and I'm going to mix it with this step from process tracing, for example. So the third, that's methods and data, the second point. The third point, causal analysis. That's perhaps the if the first point is the most important part, what questions do you want to ask? And I think the third point is probably the third and fourth, really, are the hard. Well, they're all hard, but they're all fun as well. The causal analysis. So how do you actually get all of this data and then assemble it all into a way from which you can draw some kind of causal conclusion? And the fourth part is about, well, you might have lots of different possible causal hypotheses being confirmed or rising to the surface, but then how do you make an evaluative judgment about which of these are actually strong enough findings that you can say as an evaluator, using my evaluative judgment or our evaluated judgment, this seems like a robust finding. So we'll say, yeah, on balance, this causes that or contributes to that. And an important part of that is, on the one hand, triangulation. So triangulation is another word we can use in different ways, but here I think we're using it mostly to talk about sense making, checking back with stakeholders. Does this make sense to you? Have we used the right words? Are we thinking right? Are we thinking the same as you guys? And specifically in terms of making evaluative judgments, we're going to be talking also a little bit about how you can use rubrics to do that. So evaluation, design, and questions, which is also me. So this is the first of these sections, evaluation, design, and questions. It says be aware at the top here, because what we're talking about here is making causal inferences in a sense. And what we mean by that is deciding that we have enough evidence to say that on balance, it seems like intervention C contributed to outcome P, for example. We're not going to be able to prove it, but we're going to be able to, on balance, look at the evidence and publish the evidence and say it seems to us fair to assume that this intervention had a causal influence or made a contribution to a certain outcome. So there's quite a lot of things involved there. For example, we might want to focus very much on trusted sources, experts even. Might be internal experts, and might be or external experts, and maybe quite a few of these experts have all agreed that smoking causes cancer, for example. So the extent to which sources are trustworthy can be a very important thing to bear in mind. Another thing to bear in mind is, are we trying to make inferences along a causal chain, what we can call transitivity? So it's a crucial thing that we sometimes tend to forget. So it could be that, for example, we've got a lot of evidence that a certain intervention contributed to a behavior change, and then we've got a lot of evidence that a certain behavior change, the same one, was contributing to a reduction in, say, mortality or morbidity. And we think, oh, great, so we've now got evidence that the intervention contributed to the drop in mortality, but that doesn't, to make that conclusion, we've got to be sure, oh, hang on, we're going down the causal chain here. Just because A contributed to B and B contributed to C doesn't necessarily mean that A contributes to C. We've got to think about that. So that's a little bit of a caveat. Are we going to be using, if we're using special methods like process tracing, there might be a way to, well, we'll talk about process tracing in a minute because that's something that's rather special. Also, are we going to be weighing up the evidence from multiple sources? Not many sources, there might be 50 or 20 or 100 or 2,000 sources of the same or different types. That's an additional thing to bear in mind, is what tools am I going to use to aggregate or synthesize information from maybe very many sources of maybe different types. And finally, in the end, whatever you do, whether you're using a randomized controlled trial or simply 3 or 4 interviews, in the end, what it comes down to, the bottom line, it's your evaluative judgment as a individual or group of evaluators to say that on balance, we weighed up this evidence just like a judge, and we sign off that we think it's fair to conclude from this that whatever the conclusion or finding is. So in the end, it comes down to evaluative judgment. And the little green bubble there says, don't forget that causal beliefs are not causal facts. So it's always very good to distinguish between evidence, the fact that a lot of people said a certain thing, or they saw, or they said they saw a certain thing happening, isn't the same, of course, as it happening, because people can be, often they're right, but sometimes people are wrong. So it's another slide with my name on it. So, I like this one. So here we've got what kind of questions, what kind of causal evaluation questions you might have. You might have a question like a normal evaluation question like sustainability is not normally, or relevance is not normally formulated in a causal way, although you can probably understand it, you can read it, interpret it as a causal kind of question. But here are specifically, explicitly causal evaluation questions. And the kind of overarching one, if you like, is how, why, for whom, and under what conditions is some initiative contributing to some outcome? Maybe positive, maybe negative, maybe intended, maybe unintended. That's a kind of generic template for the kind of question we can try to answer with causal pathways methods. So that can break down into different, it's not definitive, but it's a good typical overall generic example. Then we can break that down into what kind of outcomes are people reporting. It might be, for example, you're only looking for specific outcomes that are planned, but you might also be looking for also unplanned outcomes or unexpected outcomes. You're probably going to be looking to what people are saying are what they saw or what their vision or view is of the processes which led to certain outcomes. And an outcome, of course, might be a change, or it might be a change not happening. It might be a prevention initiative. And people might be noticing contextual conditions that enabled or inhibited these things to happen. So, and you'll notice here that, if you come from more of a quantitative background, you'll be thinking like, but we have very special methods for deducing or inferring causality, which have got nothing to do with people, because people are just people and they can't see the counterfactual, they can't see the other half of life. But I think there's very good reason to believe that human beings are actually very good causation detectors. If we weren't, we wouldn't have survived. In fact, mammals probably and animals are quite good causation detectors, and human beings are certainly very good on average. Otherwise, you couldn't get your kids to school in the morning, and you couldn't work out how to work the TV remote control, and you couldn't work out how to get the lid of the bin open, or all kinds of different things you couldn't do if we weren't in general pretty good at managing causal connections and kind of working things out intuitively. Yes, we are subject to illusions. Yes, we are subject to bias, very much so, but that's on the back against the background of the fact that we do actually detect causation all of the time, humans. So we should listen to humans. And if people say, this only seems to happen when it's raining and not when it's sunny, then we should listen to them. They might be wrong, but it's certainly a good place to start. Did any unexpected causal pathways develop? So maybe we're expecting an influence of A on B, but we didn't expect to see A also influencing C. So that's something, sorry, A and B, yes, A and C, but that's also something we might want to note down. We also might want to compare different groups, men and women, for example, or maybe groups who are in different parts of a country or subject to different treatments. And as I mentioned before, don't forget to that there's a little bit of a difference between simply trying to look at whether A influenced B and maybe B influenced C. It's quite another thing to then try to infer that A indirectly influenced C, possibly via B. It's something something we can do, but we have to be quite careful about doing. So now back to you, Fiona, who's going to put all of that very abstract stuff into a bit more of a concrete light.
Thanks, Steve. Yeah, so throughout you're going to notice that I'm talking specifically about the case study, and so we'll go back and forth, hopefully trying to give you an applied example in each section. So if in terms of setting the evaluation questions for the Maziko evaluation, we went back to the theory of change. And that is something which most of you will be doing when it comes to deciding how to approach your evaluation and what the main questions are that you need to answer. So all of those questions that Steve posted up earlier were relevant and important for us to answer. And the theory of change helped to dictate how we framed the evaluation design, who we spoke to, and what questions each different aspect of the evaluation tried to answer. So our aim was to look for those causal mechanisms, the context and the combinations that people are talking about in their stories of change. So you'll see here that the table just covers very broadly at a high level what each different component of the evaluation was trying to answer. And obviously we're focusing here on the qualitative part of the evaluation, which focused on what intended beneficiaries, that's the mothers in this case in the households, thought had changed and how they thought that change had happened. And we're looking for causal mechanisms, context, combinations, processes and effects. Next slide. So this is general, this is not specific to Maziko, this slide, and this is really the sort of reality check piece. So everyone has to address the reality and the limits of the context in which you're working. And these criteria can also help to limit in a good way and focus your planning for your evaluation. So which of the many potential causal pathways should you and can you explore? So, for example, your questions might lead you to focus on a set of pathways that are very useful and matter to your stakeholders, but the timing of some of those pathways might not be right. So, for example, in the Maziko context, we discovered belatedly that 2 of the interventions we were testing were very late to roll out. So, in fact, we found out very little about those pathways, and it would have been nice to know that beforehand because we could have allocated those resources and that time to look for other things. So you really want to focus on the aspects and the pathways which you're most likely to find something useful about based on the timing and who you can speak to. So don't try and answer all the questions because it sounds like a good thing to do. Think realistically about how to maximize your opportunity. You also need to think about minimizing harm or potentially negative effects on the program, particularly if it's midterm and things are still happening. You might have a question that suggests that a pathway related to a current strategy, possibly around advocacy, is really critical, but to investigate it may risk derailing the advocacy work that's going on, and this might cause harm to the programme. So you might need to look at other pathways that are less clear and that might be useful to find out about, that are sort of other contextual factors that may be helpful. In terms of feasibility, the more flexible an evaluation is in terms of time and human and financial resources, then obviously the more causal pathways you can explore and the more iterative and rigorous you can be about that process. But being iterative and rigorous costs a lot of money, takes a lot of time, and so most people are limited with their resources and are time bound. You don't often have an opportunity to keep going back into the field and changing, and even though that's really good in theory to be able to do, you're not always going to have that opportunity. So your job is going to be to balance the resources and the time that you have to deliver something with sufficient quality and rigor. So this is probably going to mean focusing on narrower or fewer questions and speaking to a smaller number of people who you might think will have something really important to tell you. So we're going to ask you later on to think about an initiative that you're evaluating or considering evaluating, and as well as and these criteria for thinking about which causal pathways to explore. So it will be helpful for you to think about what one change you would like to better understand through a causal pathways evaluation. And that's tough because we all want to try and answer lots of questions. So it's a good exercise to start to prioritize what's important for you. Okay, next slide. So in the Maziko case, we were asked specifically to look for reported mechanisms within different intervention arms. So there were different groups who received different packages of interventions, and we focused on arms 2, 3, and 4. So arm 1 is effectively like a control group in this case, so we didn't speak to them. So there's no prospect of arm 4 being scalable. They've thrown everything at arm 4. So they're interested in understanding what are the mechanisms going on in arm 4, but they're never going to roll this out nationally. So the interesting thing here is what are the differences between these groups and what can we discover from the throwing the kitchen sink at it approach that may be useful to pick out the most impactful elements for when we do come to scaling it. So the missing information for them at midline, because they had monitoring data and they had already done the RCT before we went in. And so we knew that the pathways they knew least about was why arm 3, who received a lower cash transfer, were not reporting the level of outcomes that they expected in comparison with arm 2, who didn't receive any cash at all. So it was very important that we looked at the differences between these groups and focused our questions on the outcome areas that they were expecting to see results in. So this is a very, very simplistic diagram, just to show what questions we're trying to answer with the different parts of the evaluation. So very simplistically, the RCT was designed to look simply at the information we know about what was delivered to each group and what outcomes were reported. There's no information collected on the behaviours and the actions of the actors in the middle. In this particular case, we're looking at differences in reported outcomes and the correlation between the groups. Next slide. In the process evaluation, we're looking at the results of the detailed monitoring data and understanding which parts of the system worked as expected in terms of delivery and not, and why. So this starts to look at those delivery mechanisms from the perspective of what we've called in this diagram, actor A. So that could be a community health worker or civil servant. There's likely to be lots of those kinds of actors, but it doesn't tell us about the perspective of actor B, so the intended beneficiaries. We're in sort of delivery mode here. So the next slide, this is where the quick comes in. So we're asking the intended beneficiaries, actor B, to explain how they think change has happened. And we ask them to track backwards to the intervention, maybe, if they decide to tell us about that or other things, and forwards to what outcomes this has led to. So this helps us to understand more links and pathways along the chain. When we put them all together in the next slide, then we hope to be able to answer all those questions on how, why, for whom, and under what conditions is an initiative contributing to intended or unintended outcomes. Okay, over to you, Steve.
Right, great. So you've got some evaluation questions. You've focused a little bit, so you know you're not going to try and find every single thing. But you're looking somewhere down that staircase that Fiona's just shown us. You've got a little bit more of an idea about which stakeholders, which parts of which interventions and which outcomes, which are the things where you want to, which we want to prioritize. But then one of the kind of most, I guess, frightening things or overwhelming things is like, oh my gosh, there are so many different methods. Which ones should I use? And I think one thing that kind of to encourage you is that nobody knows all of these different methods. Obviously, everyone's got their own favorites, things they're familiar with. So you look at the expertise you've got and you use, of course, the expertise you've got. So if you're quite familiar with most significant change, then that's going to be one of the things on your menu, isn't it? And if you've got a colleague who's familiar with outcome harvesting, that's something else that you can offer. You can't expect that any individual is ever going to master all of these because nobody in the world does, really. Alison, if you could kind of click perhaps a little bit gradually, slowly and exploratorily. Yeah, so for example, you might have some expertise in.
Yeah, Steve, are we going to check in and see what kind of expertise we have in the room?
Oh, yes, very good. Yes, yes, please do.
So we were curious to know of just a handful of the methods. I see this great conversation happening in the chat of distinguishing between causal pathways evaluation and as a methodology itself versus sort of a umbrella, a framework to think about and plug different methodologies into. We wanted to get a sense of which ones you're familiar with. So there's a little poll that's popped up. We hope you'll answer it and we'll get some good data from that about what do we got in the room. And what are people interested in exploring a bit more? Wonderful. It's doing its little mathy things. Is anyone seeing the, oh, here we go. So it looks like what's really great is that there are folks in the room with us right now who have familiarity with all of these. And the most common methodology is outcome harvesting, and which it's about 74% of the respondents are familiar with, and then contribution analysis after that. And it looks like in terms of using them before, those are the two most common, as well as folks who admitted to having used none of them, which is totally great. I'm in that camp too. And then in terms of the method you're most interested in learning more about, we're seeing a lot of interest in contribution analysis, causal mapping, and QUIP, which is great given the example we have for today.
This is great because I should also say that QUIP is a form of contribution analysis. So I hope that we will keep a lot of you happy today.
Oh, fantastic. Well, I'll hand it back to you, Steve, but just wanted to make sure we got a sense of, you know, we know there's such a wealth of knowledge already on this call with us, and we wanted to bring it into the room. Thanks.
Absolutely, yes. Thank you. And it's interesting there, I noticed that a lot of people say outcome harvesting stands out there as something that people say, oh yeah, I've kind of done that. And I kind of, for that reason, maybe don't want to hear too much about it now because I already know what it is. And in fact, no reason to worry because in fact, outcome harvesting is not necessarily a causal pathways method. It can be, but it's kind of one of those guys that's sitting on the fence a little bit, I think. So if we go back to, I've got to close the poll for me. So yes, process tracing pops up there as one of the ones that people did mention they might be interested in. So process tracing is, it's very powerful when you've got maybe adversarial different hypotheses. So there's it's often used for high stakes evaluations, often for just one or two crucial links inside a program theory or theory of change, where something very important and perhaps expensive and valuable is going on, and there might be competing alternatives like, oh, people are lying, or it's a placebo effect, or where you can, it's more like applying a sort of, yes, it's a very high stakes way of weighing up different kinds of evidence, something like you might do in a courtroom. Well, we're talking about more changes within a whole system, then there are various methods, causal link monitoring, contribution analysis, causal mapping, and other methods help you to visualize all of these different links inside of a larger system or network of causal relationships. Outcome harvesting, as we said, is something that's a little bit on the, it's good at capturing unexpected and unplanned outcomes as well as planned ones. Sometimes it's kind of like, what's the right word, causally agnostic, but sometimes it does actually explicitly try to capture pathways to longer pathways from intervention to outcome. Realist evaluation helps us to think about specific mechanisms. Normally when we say mechanism, it's perhaps a little bit counterintuitively, we're talking about actually the way that people think, or groups of people think, the way they make decisions kind of in their own life worlds. So the reason, like nudge theory, so the reason why people are finally behaving in this way is because that makes sense to them, and they've been given this information and have these expectations, and a certain kind of behavior kind of emerges. So these kinds of what can also be called mechanisms. So that's, broadly speaking, falls under the causal pathways umbrella. Most of these methods, I think all of them, also pay attention to context. QUIP is, as Fiona mentioned, is particularly good when you're looking at causal pathways across a relatively large number of subjects, maybe 24 or 48, something like that, inside a complex context. So it's not simply everything happening according to a very simple theory of change. And we want to know how people understand its impact. But of course, that in real life, things happen, and you might start off with a certain plan for how the evaluation is going to work, and you end up tweaking it, adding bits, removing bits, and as long as this is documented, that's great. And as with most other forms of evaluations in real life, you know, you make adjustments, you check back with the evaluation committee, and you agree to make some changes to your method. And of course, bricolage, like we said, is like, not only bricolage isn't only about mixing, oh, I'm going to use process tracing and outcome harvesting, which might be quite a big ask, actually. It might be that you say, well, I'm not really going to do the whole of process tracing, but I am going to use the concept of a hoop test, for example, in my weighing up of the evidence. So bricolage isn't just about mixing packages, it's about taking packages apart and mixing parts of those packages. And as I said before, you're all going to take into account, of course, the expertise of yourself or in your team, and do the things you're most familiar with. And it says, yes, so the next slide. So the QUIP there in causal mapping, sorry, if you could just go back, they're in orange and slightly lighter orange because that's the focus of the example that we're bringing for you today. And then the next slide is just about bricolage. So saying that you might, for example, say that because it's a relatively high stakes evaluation about a relatively specific causal link, I might be deciding to use process tracing, but then I'm also interested in contribution, and I'm also interested in how these contributions of other parts of the whole program fit together. And I've got a theory of change. I think it's quite a good theory of change, and I'm going to use this theory of change to visualize the different connections, how they fit together, and to look at the contribution of the program along these different arrows. So that's contribution analysis I might add as well, for example. Or you might say, look, the commissioner and even the program team and the evaluators, they seem to be living on different planets here, and the people themselves on the ground, so to speak, are thinking in a different way, and they've got different values, and they don't think in the same way. So maybe I might apply most significant change method, which is one of probably, it's not simple, but it's one of the more straightforward methods to use. It's not actually listed here, but it's certainly one of many, which you might use which is very good at helping to start a discussion about values and values of different groups. And it's a very participatory process that can help to get the whole network of different people to discuss, like, what's actually important here and what do we value the most. So that's an example of bricolage where you might perhaps use parts of perhaps 3 different methods to answer your evaluation questions. And then it's back to Fiona.
Thank you. Before I move on to talk about Maziko, I'm aware that in the time we have, we can't go into detail about all of these methods. So I've just posted in the chat a link to the Better Evaluation page, which has a jumping off point for each of these. And there is also a tool to help you consider which aspects of your evaluation are important and to help you build an approach. So I'm sorry that we won't be able to go into the nitty-gritty of all of them today. So as Steve said, we're going to focus on QUIP and causal mapping. So hopefully we can answer those questions, and then that'll help you to go off in different directions and think about which bits will be appropriate for your evaluation. So coming back to Maziko, the QUIP approach, as I've said before, is very focused on getting the perspective of the intended beneficiaries. So we collect stories of change from them. The difference with the most significant change approach is that we don't then ask them to sort those stories. We do the coding separately. Now, this is partly because of the way that we ask the question. So the way we run interviews is a little bit different. It's called a goal-free approach, or you might have heard it referred to as using blindfolding, open-ended questioning. Essentially, we are trying to give the agency to the people we're speaking to, in this case, the parents, to explain in their words what they think has impacted their behaviours and actions in relation to questions around broad impact domains, without being led down a particular path by asking them about the intervention. So the interviewers at no point would talk about the intervention or any of those donors that were involved. And to aid that, we don't share the theory of change with the interviewers. The amount of information they know about the evaluation depends on the context. So that's another whole hour's discussion. But essentially, we're trying to keep the interviews as open-ended as possible, and it's a conversation that is framed around outcome areas, rather than saying, so tell me what you thought about the cash that you received. What did you do with the cash that you received? Are you eating more food because of the cash that you received? You can see how those kind of leading questions will just give you one type of answer. So instead, we just flip it round and ask people to tell us about the food that they're eating and what changes have they made to their diets, and to explain why things have got better or worse. And it's probably a bit of both. In this case, it definitely was. In complex contexts, you tend to get ups and downs. So the idea of this approach is to reduce confirmation bias, to give a little bit more confidence in what people are telling you, to give you more information about unexpected drivers and outcomes, and to really get at the nitty-gritty of all those different intersections of bundles and packages and contexts and how all that works together. So next slide. In this case, we took the more detailed theory change that we looked at with Save the Children, and we've focused on 5 main areas where we expected the lives of these families to have changed in some way. Their expectation was, well, they've been involved in this intervention. We think that they've got something interesting to tell us about the access to and use of money, production of and consumption of food, health of everyone in the family, particularly children and mothers, family relationships and parenting practices, and maternal well-being, which included knowing what to do if she felt low or depressed, and what support she felt she was able to access. We also conducted focus groups with fathers to find out more about their thoughts on parenting, how much they were involved, whether that's changed, and chore sharing. So the interviewers are trained to backchain from initial answers about stories of change. They'll start with, tell me what's changed in the type of food that you eat, for example, and then they would probe for more information about, why do you think that's changed? Why did that particular behavior change? wait for their response, and then back chain again. So they'll try and get as many connections in that chain as possible so that we can then start to build those chains forward when we come to do the analysis. So it's really important that those interviewers know how to collect and elicit those kind of detailed stories of change. If they stop just at one link and we don't know what caused that, then we're stuck in a slightly frustrating situation. So that's something we spend quite a lot of time and care over, is testing the interview to make sure that it does elicit those kind of quite open-ended, free-flowing conversations, but also knowing how to probe without knowing what they're looking for. And that's easier said than done. And some people are like, how can you ask questions if you don't know what you're looking for? Well, actually, for the interviewers say to us that they prefer not to know what we're looking for, because it makes their job easier to have a conversation, but they still need to know the techniques for how to get the detail that we need to be able to map the causal connections sufficiently. So we're going to move into breakout rooms now, and then after the breakout, we're going to talk about all the data that we collected in these in-depth interviews and how we analysed it in relation to the evaluation questions that we talked about at the beginning of this section.
Fantastic. Thanks so much, Fiona. So before we go to breakouts, we want to give you a chance to connect the types of evaluation questions and methods together with your own work a little bit. So before we go to breakouts, we want to give you about 3 minutes to do some individual reflection and jot down some thoughts for yourself on the following questions related to an initiative or program with which you're familiar. And those questions are, what causal questions might you ask related to it? Steve mentioned that earlier when he was walking through the idea of causal questions, that, think about what kind of question, maybe one or two, that you would want to explore in a body of work you're doing. Which related causal pathways might you explore? And how would exploring these causal pathways benefit the initiative or program? So saying that another way, what would it make possible? So we're going to give you 3 minutes, so till 59 after. I'm going to turn off sound and we're just going to be quiet together, a little space for reflection. And then we'll come back together and I'll let you know what we're doing next. All right. Welcome back. Hopefully for those who like a little time and space to reflect before jumping into conversation, that was useful time for you. So what we're going to offer you next is if you are a person who is interested in participating in a breakout room and talking about these ideas with some colleagues, we're going to open up some rooms and you get to select yourself into them. We would suggest that each room try and have about 4 to 5 people in it because we only have about 10 minutes to get this conversation going in this way. And I'm seeing in the chat that some people aren't in a position to do a breakout. And if you aren't, we welcome you to stay here in the main room and use the time for an extended individual reflection on these questions. And we're going to reconvene as a full group at 10 after the hour. I want to encourage you that during the course of your discussion or personal reflection, if you notice any insights or connections or ahas or questions, jot them down so you can share it back in our larger group debrief. And we want to encourage you to come back because after this activity, we'll be digging into data analysis and assessing the strength of evidence, which for a session that's about the nitty gritty of causal pathways evaluation, we think that's really getting into the nitty gritty. So thank you so much. Carolina, are we ready to open up the rooms for those who are interested in choosing that adventure together? We saw that there were a couple of rooms having some conversations going on. In the chat, we love it if you share any lingering or emerging questions, insights, or key takeaways, or ideas that stood out to you when you were chatting. And if anyone is game to share something verbally, we'd love that. Feel free to put a hand up and we'll call on you. I'm good at waiting this out. I used to work with the Quakers and they always talk about the idea of being moved to speak. So I'd love to get 1 or 2 people to share just an insight or question that's popping up for you. And if you're not a speak up person, in the chat is great.
Looks like Joy has their hand up.
Great. Thanks, Joy.
I was just going to make an overall comment. I guess it's maybe not quite an insight. Many of us in the group are sort of working in situations where there's like initial work around kind of both the purpose and the types of change. So that might be outcome harvesting or just even people understanding why the evaluation is happening. And I think in some of these cases, the causality question is always there. And we want it, but I guess we're always having to kind of walk people toward that. And there's, as evaluators, part of our practice is not just, of course, doing the evaluation, but like supporting people on their journey to think about, what kind of causal mechanisms might be there, how to not be worried about bad news, and so forth. And I think even thinking through possible pathways with a client would be itself, I think, an interesting part of practice to kind of evolve. So I know that we don't want to be the ones, I don't want to be the one developing the hypotheses. And so it seems like in these examples, it's fabulous to have conversations about getting data on certain causal pathways, but we might also be needing to kind of interrogate the possibility of pathways and that whole front end work of the process. Anyway, that's the best I can articulate it.
That's a really rich comment. So thank you so much for bringing that forth to the group. I think we were touching on a little of it in just our little check-in of some of that stuff. So I hope that we have more time to get into that when we have some time at the end of the session as well. So thanks, Joy. And then am I seeing, and I don't know if you pronounce your name, Anne-Marie, Anne-Maria? You tell me.
Yeah. Both are perfectly fine.
Okay.
Anna-Marie. We were in our group, I think we had some discussions about that this approach and method package seems to be quite promising and interesting in terms of back tracing outcomes, results from end beneficiary towards your theory of change or in another direction. That was one. Then another difficulty or challenge is how you deal with a legacy theory of change that then needs to inform your evaluative thinking to an intervention that it's going on or happening, but you were not part of the building of theory of change. And linked with theory of change, causal models, was a discussion about the tendency of individuals to simplify the complexity to understandable and reachable, easy to understand models that can be oversimplification, inclusive of causal chain. And that, from my experience also, that deals a lot with forgetting about assumptions or not interrogating assumptions in these causal pathways. And one of my specific difficulty currently is that within a very complex intervention, one decision that is difficult is to really focus in the most important change pathways and deciding between, I don't know, 10, which ones it's worth further investigate. And I think the evaluator can be a very good friend to a project implementation team in order to make sense and give a correct answer to this to the first question before we start designing the evaluation and, you know, building in budgets and timelines and so on. So.
Thank you. That's a really good and important point. And I've found myself in a position of almost being like a counsellor and a mediator many times on this, because every stakeholder, often these evaluations involve different stakeholders and everyone has their own priority, and they look to the evaluator to answer all of their questions. And it's really important that you don't fall into the trap of thinking that you need to do that. So as an outsider, it might be easier for you to see what's realistic and important and impactful than it is for them with their sort of slightly vested interests. So it's an important role that you play at the start, and also for protecting yourself, because you won't be able to deliver to everyone's needs. So you have to be really clear about that from the start, so that you're setting expectations. I mean, apart from anything,
Yes.
if you are going to do things using interviews, like we've talked about so far, and there are other ways of collecting data, obviously, but what I have to remind people is that you can't run interviews that are really, really long, because people will just lose interest. They won't have the capacity to be able to answer all of those questions. So, you know, our interviews are typically 45 minutes to an hour, which is long, and you can't do anything more than that. That's asking too much. So really 5 or 6 domains is where we say you can't do more than that. So you've got to decide where your priorities are. And I think that slide that we showed that helps you like work out the important things will be really useful to go back to.
Nice.
Yes, Anna-Marie, right, you brought up quite a few things, but another thing you mentioned was people oversimplifying, and that's an interesting thing to query, because it's perfectly possible, of course, that, you know, you might have one or more people who break a certain pathway down into certain pieces and they articulate that, whereas somebody else might say, oh yeah, but this is leading to that, and like they've got kind of an overarching thing where they put it all together. And it might be useful to ask in that case, like, well, what's your evidence for thinking all of that? Because, you know, causality is a lot more mysterious, or the way that humans perceive and understand causality is a lot more mysterious than, and a bit hard to understand perhaps than you think. And it's possible that one person can perceive and have actual information or evidence for like a whole causal chain, the 2 or 3 parts of it, and someone else sees the different parts of it as independent moving parts. But of course, it's also possible that someone's just waffling and just says, oh, this totally causes that, without really having ever get any evidence for it other than you know, just hoping it's like that. So I think a good initiative there is to say, well, what's your evidence for that? Like, how do you know that this whole thing is happening? And maybe that answer is then indeed something that's composed of smaller parts, or maybe it isn't, depends what's going on there.
Well, it sounds like we have more rich conversation to have when we get to Q&A in a little bit. But we've been here for a while, and we thought, let's take a 5-minute comfort break and make sure everyone gets what they need to take care of done, whether that's rehydrating, caffeinating, or the other part of the process if you need to go to the bathroom or just stretch. So please join us back here at 25 after, and you're not going to want to miss it because we're digging into data analysis and quality of evidence. So come back. Thanks so much, everyone. See you at 25 after the hour. If you are back in the room, if you could give us a reaction or throw something in the chat, just so we know people are back from break. Thank you. Thank you, Zohar. And Mary Lou. Ooh, it's fun to see a lot of thumbs up pop up on the screen. Appreciate it. Yeah, wonderful. Well, it's what you've all been waiting for. Causal pathways data analysis. So back to Steve.
Right. Okay. That's make it sound like I'm going to do some kind of like trapeze act or something, or spin across the circus. I mean, the next slide, we're just talking about really 4 parts of the causal analysis phase, which Tom Aston and Marina Apgar developed these 4 steps. The first part is just what we were discussing before, which is like, from all the different possible research questions or which parts of your possible causal network you might want to focus on, which ones are you going to focus on? So you can't afford to do all of them because each thing costs money. So answering which questions would be most useful for you or your clients or your stakeholders, and which are you going to focus on? Of course, that depends not only on what's important, but also on what's feasible and what's most expensive. What you can do in the time allowed, and so on and so forth. And ideally, of course, this decision about which parts to focus on would be a participatory thing, which would involve different stakeholders. And often it can be extremely enriched. In fact, if you can manage to do that and include participation in that process, then you'll probably find you've got better questions that are more relevant and possibly even easier to answer. Sometimes it can be expensive, of course, also to include participation and to have the time and the space to get a real debate going. But if you can, then that's extremely useful. So, I mean, we talk more about that, and there's 3 more steps that we're going to go through in a minute, but I think we'll move to the next slide. So this part, I think, is probably the easiest part, or the part with the least kind of disagreement, which is coding for causality. So this is something relatively specialized. So if you assume that you've got interviews, documents, observations probably in text form, you've got some kind of corpus of this data in front of you. Maybe it's 12 interviews, or maybe it's 1200 interviews. How are you going to actually highlight the causal information within it? And it's something that we've all done, I suppose, in some form as evaluators, but in a more or less systematic way. We think of coding for causality as being essentially highlighting parts of text, sentences, phrases, quotes, paragraphs, where somebody says or implies that one thing causes or influences something else. That's kind of the key activity. And it's possible to do that in a en vivo sort of way. So where you're essentially finding a tag or a code for each causal claim. So the code might be something like non-profits are driving advocacy change or something like that. But the trouble with that is that these are kind of monolithic tags. So it's got non-profits driving on the one hand, and it's got advocacy change on the other half. And normally what you do is you'd break your codes, if you like, up into two parts, the cause and the effect. And so you'd start to go again through your data, but you'd be highlighting non-profit activities and then change in advocacy of some particular kind. And then you'd be coding the link between them, so it's more differentiated. You're not just coding the whole causal claim, but you're coding the parts of it. If you use a tool like our causal map, or if you use perhaps in vivo for this, then what you're probably doing is sorry, not in vivo, but Kumu, which we'll talk about in a minute, then you're essentially coding the entire claim, but that claim consists of two things, the cause and the effect and the link between them all at once. So if you imagine this as an Excel sheet, then one row has got three columns. It's got the cause and the effect and probably the quote. Those are the essential parts. So if somebody says, oh, I think non-profits are driving advocacy change, then you've got non-profits driving and you've got advocacy change as the cause and the effect, and you've got that thing as the quote in your third column. So that's essentially, if you imagine as you're going through your narratives, your text, then each of those rows is a single causal claim about a link between one cause and one effect. When we say cause, we just mean contribution or influence. We're not talking about any kind of a complete determination, of course. Yes, and some people do use Excel for exactly this purpose. So Fiona.
Okay, this is a screenshot from the app Causal Map, which we use to code our QUIP data. I don't expect you to be able to read what's on the screen, but it's just showing that there's text on the left. We highlight sections, as Steve said. And when we're coding, we will always have two factors, influence factor and a consequence factor, and those are joined by an arrow. And they can turn into longer causal chains, and you can have multiple drivers of one particular outcome, multiple outcomes from one driver. So the idea of doing this is that we will go systematically through all of the data, all the interviews, and in this case, we do this manually. There are AI ways of doing this, but for us, we deal with relatively small numbers of interviews, so we prefer to do it by hand. So in this case, it was 96 long interviews, so it was quite a lot of data. That's pretty much the top end of what we would code manually. But that enables us to start doing it inductively, as Steve says. So we just code what's there. We just code the causal mechanisms people are describing. But then we'll go back and start to add some extra information about attribution if people are actually telling us specific drivers that we know relate to the theory of change. So then we can start to craft it in a way that becomes more useful for us when we come to make evaluative judgments. So the next slide. So the idea is that once everything's coded, we aggregate all the links together and we're starting to look for patterns as well as outliers. And we're looking within the groups, across the groups, what are the differences and common aspects in the different pathways? How does this compare to the theory of change? So we can query particular drivers that relate to the interventions and what happens as a result of that, or the outcomes that we were expecting and what people said were the drivers of that, which may not be the same as our expectation. And of course, we come back to what people said. So that text that sits behind the links is super important. So we will always supplement our analysis with quotes to where people describe what that change means for them. And that means it's also kind of peer reviewable, it's auditable for people to see how we've come to that judgment. And we'll go back to those questions. I've just put the screenshot there of the questions that we asked earlier to really understand what the outcomes are and what the context is that people are explaining that in. The transitivity question at the end there is really important. So we will look very carefully at threads, we call them, to avoid falling into a transitivity trap. So not sticking different parts of different people's stories together. So when we do the analysis, we really make sure to be careful that we're looking at complete threads when we're making evaluative judgments about something at the top of a longer causal chain linking to something at the end of it. Next slide. So this is an example causal map where we have looked for specifically, because the things are outlined in yellow, for things that have driven improved diversity and quantity of food consumption. So these were expected outcomes. As I said, we interviewed 96 people. So obviously not everybody has said that they have experienced these two factors. We've got 49 people said that their diversity of food had gone up, and 33 people said that they had more food. So then we're starting to look at the pathways within that of how people describe them getting to that stage. And we can also look at these separately and obviously look at the differences between them. So the numbers on the links are the number of people who've made that connection between the two boxes that are linked together, and the numbers in the boxes are the total number of people who have cited that particular factor. So in this example, the lines are a bit thicker, they're scaled, so we can see that access to financial resources, so income mainly from the cash transfer, was the most important factor cited in relation to diversity and quantity. But we do see references to the advice and guidance that they got from the different care groups and health centres, but it's much more limited. Okay, next slide. This is a sort of handmade summary of the whole map, because we end up with loads and loads of these maps, which we zoom into much more detail for to answer each of the questions that we had. But as an overview, again, this is scaled, although we don't have numbers on it. So this is us looking specifically at the downstream positive impacts of the key aspects of the interventions. So down on the left in the blue boxes is all the things which they delivered, and we're looking at what are the consequences of those as they go downstream. So we can show there's a mixed picture due to unexpected contextual factors. So we've got very difficult climatic conditions and a huge increase in the price of food due to devaluation of the Malawian currency, as well as the impacts of the war in Ukraine, which seriously affected the cost of grain. So these unexpected external factors had a big impact on the expected outcomes. And so we saw the most positive effects were in the high cash group, which, as I mentioned earlier, was not planned to be scaled up. And in fact, the low cash group was just not sufficient enough for them to get much benefit from it. So there were some mitigating benefits from the participation in these activities, but you can see that the thicker lines that are at the beginning relating to the plus interventions indicate that people took part in them and learned new skills from these activities, but were unable to apply them sufficiently without access to cash. And you can see that from the thinner lines that come towards the right-hand side of the map. So high levels of participation and learning, but less substantive change in health and food outcomes. Steve, I'm going to pass to you for the next slide.
Right, yes, this is quite simple because it's just an example from Kumu.io, if you're not aware of it. Very nice systems mapping software, which is very useful here for organizing. If you imagine lots and lots of links on a wall with lines between them, and here we just focused on just 3 of those links. In this case, it's individual statements by individual people about how one thing led to another, and each one is annotated with the source number, so that you can go back to the original quote if necessary. So if you've got like a relatively low number of claims with a relatively sort of differentiated different group of stakeholders, then you can totally get a handle on this very nicely with something like Kumu. If you've got a larger number of larger amount of data with a lot of kind of overlapping themes, then you might want to use more specialized software like Causal Map that we provide, but also it's possible to do that kind of thing in Excel as well. In fact, you can enter Excel and Causal Map and Kumu can all interact with one another, so it's a somewhat common data format. That's probably all we need to say about that slide at the moment. Do I read out slide 43? We'll go straight on to the next section, yeah? So in terms of assessing we've given this section somewhat different titles. So it's about the strength of evidence, but it's also about how you can make a causal judgment on the basis of all of the material you've collected. I think probably the first thing you're going to do is you're going to, unless you just agreed you're only going to look at one causal link in the first place, you do really have to zoom in. So if you've got like a network of different causal claims, you have to say, right, now let's look at just the paths from this particular intervention to this particular outcome, and show me only those links. So your software can do that for you, or you can manually organize just exactly those links and those quotes and that evidence. That's kind of an essential part of causal pathways work, or causal mapping, I guess, is to say, let's just source and surface just exactly the information I need to look at just exactly this link, or maybe 2 or 3 links or paths. Very important there to think about, and something that's often skipped, I think, in causal pathways work is, does all this information come from the same context? Or have I made the mistake of maybe in one part of one link in the pathway, I've got information from kind of men in the north half of the country, and the bottom half, the next link, I've got information all from women in the other half of the country. And maybe these are actually talking about incompatible contexts. And so I can't necessarily transitively assume that the thing at one end of the chain is really influencing the thing at the other end of the chain. That's something you've got to be very careful about, and use common sense or just note taking or software to make that kind of overlap or lack of overlap in the context clear.
So can I just
And
jump
then
in really quickly there,
yeah,
Steve? The flip side of that is it is also interesting and possible when you're dealing with multiple different stakeholders who have different pieces of the puzzle to build a map where they each have their own area of knowledge and they may well overlap. So in those, because there'll be many cases where someone in one government department knows one piece of the puzzle, and then the person working in the Forestry Commission knows another piece of the puzzle, and you'll need to collect all of those different pieces of evidence and put them together to understand the longer causal pathways.
yes,
Not assuming that they gel together perfectly.
yes, you've got to think about whether they come from whether the context they come from are compatible or not. And you can't just assume it, but absolutely, yes, they might be just parts of a bigger puzzle. I think someone mentioned before, like adversarial as opposed to like in an inquiry-based way of looking at a mass of evidence. Traditionally, we tend to think of, so supposing you've got 3 different arrows all pointing to, in the very simplest case, some positive outcome, and maybe 3 different NGOs have all contributed maybe to this outcome. So in a sense, you can see these as contrasting or conflicting explanations of like why this outcome happened. But I think more often in real life, these are quite likely possibly complementary explanations of different explanations of why something happened, or contributions to something happening, that we don't necessarily have to think as being competing hypotheses. But in the case of process tracing, which is a good thing, you might say, well, a priori, just without even looking at the evidence, I know there's other explanations. For example, perhaps all of these people are lying because someone paid them money, for example. And it's very important in some cases to consider, maybe completely not from the evidence, but on the basis of your own intuition or some other process, what are alternative explanations for these causal processes that seem to be surfacing here, and how can I weigh up the evidence for these different kinds of possibly competing kinds of evidence? So that's a slightly different way of looking at different task of contrasting different pieces of evidence or different hypotheses. There isn't like one single, I think, overarching kind of simple template you can use here, but we have to distinguish, certainly, like I said, between possibly complementary pieces of evidence which are all in the data set, and possibly contrasting alternative explanations which might be in your data set. So one group of people say it's due to this, and one group of people say it's due to that, or it's possible that the conflicting, so to speak, explanations come from outside. They're just it's your duty to think up, and the duty of the stakeholders too, to think up alternative and possibly competing explanations, which are maybe kind of less encouraging, but nevertheless important to consider. The next slide, yes, thank you. It's all very well to say, well, we've got this lovely big network, and it's a mistake. I think the hole that we've fallen down sometimes is just, oh, look, here's a wonderful network, like, bye. But normally the client is going to want a bit more than that. They're going to want to say, it's not only important that you've amassed some evidence here that something might be influencing something else, but is that enough? And is that good enough? Is it good enough evidence? Is it enough evidence of enough of a change? And there are different ways to address this. But it is our duty, I think, as evaluators to say, or at least be part of the process for saying, is that enough? That's the evaluative judgment part. Now, some methods like process tracing have their own way of making this kind of decision, and QUIP in a different way, I think, also does too. But sometimes there isn't an obvious way of saying what's enough. And so it can be very useful to use evaluation rubrics as far as possible, at least to some extent in advance of seeing the evidence, to say, well, what would count as a good result or a good enough result? For example, you might agree that if every single one of my stakeholders mentions having seen the intervention operating and various other criteria, then we'll give it a 3 out of 5 or a 4 out of 5 or a 5 out of 5 in terms of the quality of the evaluation itself. But that's something you have to, these rubrics have to be then assembled. They can't just be imposed on the outside by the evaluator, but have to be assembled ideally in a participatory and iterative process. And I think Fiona's going to talk about that on the next slide, yes.
Oh dear, I must stop getting distracted with the questions and focus on what I'm supposed to be saying, sorry. Right, okay, so here is an evidence matrix which we produced from the Save the Children data, and I have deliberately greyed out lots of the text because I don't want you to think that you need to read all of this. The gist of this is, okay, we've got lots of interesting maps where we delve into the pathways. We've got our nice overview map, but tell me what the evidence is that we have delivered on these outcomes and what the differences are between the groups. So that was the challenge they threw back to us, and so we produced this matrix. This is another way of looking at the data. So in this table, we've got the column on the left shows the main positive reported outcomes, and so I've left improved health as an example there in black. And then the row that follows on from that lists the main attributed source drivers. So that's going as far back as is sensible to the start of the chain, written in the corresponding boxes in each row. So with the first and the second most frequently listed. The deeper shaded boxes means that more people said that that outcome was, they reported that outcome. So we can see in this case that they're all highlighted in orange, which means that more than 50% of women reported that outcome. So this is a high number of people who've reported that their health has improved across the different groups. Highest in the high cash group because it's dark green. The two cash groups have both listed cash transfer as the first driver of change in that, and they've all listed health surveillance assistance and care groups as another driver of change in that. So we've got the two things working together. So this type of matrix just helps us to isolate the main sources of drivers of change in relation to these expected outcomes, which is a useful perspective, but it doesn't detail how. So we don't get those causal connections, we don't get the pathways, and it doesn't consider rival explanations. So we still need to look at triangulation. So triangulating data is one of the ways that we strengthen our testing of the causal relationships and how consistent they are. So we're looking for evidence supported by multiple sources. So multiple sources of evidence with each causal claim. So the numbers for us of the number of people who's claimed that particular link, but also other sources of data. And in this evaluation, obviously, we had the monitoring data and the process evaluation and the RCT as well. So you need to be sense checking and sense making across all of that information. And in this case, we did hold a sense-making workshop. We didn't run it, Save the Children did, and it involved government stakeholders in Malawi. So it was a big whole-day event where they considered all of the findings and what that meant for the second half of the rollout of this pilot and what adaptations needed to be made as a result of that. Just a note on biases. We talked about trying to mitigate, not eliminate, but mitigate bias at the point where you're collecting data. We also need to be really aware and manage how we manage our biases when we're coding and analysing the data as well. So we need to make sure we're not favouring certain theories of change and just be really reflexive in our analysis. We're open to finding other factors and events that will contribute to anticipated and unanticipated outcomes in different ways. So a lot of what I showed you did follow the intended theory of change, but there was lots of information missing. So 50% of people didn't say that their food consumption had gone up. So we've also got negative maps, which I haven't shared with you today, but we've got lots of maps which show us what stopped those people being able to reach that anticipated outcome. So all of this information has to be taken together. Steve.
Right, and I think finally, just like nothing to say about this slide, it's a nice illustration. Sense making is super important, and hopefully your evaluation has got the budgets and the breathing space to build in lots of iteration with different stakeholders at different points to discuss and make sense of all of these causal pathways from different perspectives. And it really is enriching when a stakeholder comes to you and say, oh, we don't use these words, or we don't think of it like that, look at it like this. And that's all part of reaching a good final, of finishing a high quality causal pathways evaluation, I think. So that gives us 10 minutes left for questions.
And I'm going to stop sharing the slides. We do need 2 minutes at the very end, though, to wrap up, unfortunately. So, but we'd love if there are questions that people have now or ones that you've shared previously. We've been keeping track of them, but would love someone to speak one into the room if they're ready to. Anna Maria. Oh, you're on mute.
Sorry, after years of webinars. So I really like that it's rigorous, meticulous.
You're still on mute.
What?
No, she isn't.
I
I can hear her.
Hello? Huh? Yeah,
Yeah.
it's okay.
Yeah.
So yeah, I admire the method and I see the power of it and how complex and rigorous it is. My question that is somehow trying to visualize how the end product of it look like. The question is how you, once again, simplification of complex things, how you will reflect back the insights, the results, and the analysis in a way that it's easy to understand by a non-specialist stakeholder, I know, a project manager, that it's not necessarily very familiar or interested in evaluation in general or this specific method. So how user-friendly is the end result, and how then can be fed into further cycles of reflection?
I think this is a really hard skill, actually. You've put your finger on this, and I feel that often when we're compiling a report, we have to write 2 or 3 different products to meet different audiences. So there's always like the 100-page version, which has got every possible map and quote and all the interesting details, because I don't want to lose the detail of the complexity that's involved. But then you need something which is like a brief, which is what's going to be used most likely in the kind of policy level discussions. So I think it's a case of knowing your audience, and we have those discussions with the commissioners. Sometimes they write those final brief papers because they know what their teams need, and we might help them do it, but sometimes they're better placed to interpret what they really need. But I sort of feel like an icy chill in my stomach when someone says, can you just prepare 5 slides that summarizes everything in the 100 pages? It's really, really hard to do that without doing justice to the complexity, but I also get why they do that. And that's partly where that matrix came from, because they were like, please, can we just see like something really simple that summarizes it? So the map and the matrix ended up being the kind of, okay, I can talk you through this in a couple of slides. But it doesn't do justice to everything that's behind it.
Yeah, I mean, different people are different, and some people say, "Oh, I don't understand those words. Give me a picture already." And other people say, "Oh, I can't understand that picture. Give me the words already." Like, obviously, and people are just different. And what we're experimenting with right now is underneath each map, whether it's done by human or AI isn't really important, but finding a typical story which is really the most typical, so calculating which is the most typical person or unit or organization inside that network, and just looking at their story and then telling their story inside that whole network with a headline and a subheadline, so a few words and then a sentence and then a paragraph describing all of that from the perspective of the most typical unit. And people really like that because it's kind of for words type people, it's like, oh, I can resonate with that. It's a very similar, very stupidly small summary, and then a bit of a longer summary, and then a paragraph long summary. And in each case, you can then kind of click and dig in more and find out why that person's most typical and what exactly were the original things that they said, which we use to create that summary. So that can be useful for some people. Other people don't like it.
I'm seeing Nina has a question.
Yeah, hi. Thank you so much for this session. I'm curious about how you deal, following on your comments about, how the war in Ukraine affected everything. I'm curious about how you deal with like significant external factors. So I do a lot of work in the sort of advocacy space, and like the, voting rights, democracy world. And there's a lot that happens that's completely outside of the control of these organizations that are, intervening. And I'm curious about how you represent that in the causal map, how you sort of account for that and still tease out the causal contributions that they're making.
It's difficult. We do it. I didn't show it today because it requires a little bit more of an explanation, but I alluded at the end to the fact that we had a lot of negative stories as well. And there is a way of combining those in one map, which I think is actually really important, because just presenting just the positive stories and just the negative stories doesn't give you the understanding of how those things interact together. So obviously I'm only talking about how we do it in our case. I'm not trying to represent the whole of causal pathways here, but I think, and the triangulation sense making part is really key to that, because we're not necessarily always going to hear the full story from each person we speak to. So some people said, because of the war in Ukraine, the cost of food's gone up, but a lot of people didn't. They just said the cost of food has rocketed and the value of the currency's gone down. They didn't necessarily articulate all of those external contextual factors. We have to have that information from other sources to be able to add to that information. So all we can replicate in the maps is what people have told us. So the single most important driving factor of not being able to improve your food consumption is going to be not being able to afford to buy the food. So where you then go back from there is in those discussions at that sense-making workshop is where you pull in all the factors that the government knows about, which is why the price of food has gone up so dramatically. So it's only one piece of the puzzle, and I wouldn't want to suggest that the causal maps we're presenting try to provide an entirely holistic view. There's another stage involved in that. But yes, there is a way of showing the interactions between positive and negative and showing what impact that has on the outcomes.
Thank you.
Fantastic. So I'm going to take the liberty, since we have about 2 minutes to wrap up. We really appreciate these great questions. We know that there were some other ones that we didn't have a chance to get to. And if that's the case, if we didn't get to in chat or verbally, we'll try and include either some resources or responses in the follow-up email that you'll see. In addition to that, we've alluded to some other resources, but we want to make sure that you're aware of them. I think this is right. Yep. Okay. So if you're interested in digging more deeply into all of the things we talked about today, I mean, one thing that's great about the Maziko case study is that those links, it is published, it is accessible, and a lot of times causal pathways evaluations are not fully accessible. So we just encourage you to check that out. There's also a how-to chapter with more of the step-by-step guidance and questions and things to think about as you're designing this. We also want to point out that if you're in a funding organization, Causal Pathways Initiative has a brain trust. It's an easily accessed space for funders and evaluators to engage with causal pathways experts. You can sign up for it, and I've participated in one. I'm sure, I don't know, Fiona and Steve, if you've done them, but it's like you get 3 different people. You come with a question, you're seeking some guidance, and they bring their different expertise and ideas to the work that you're doing. It's super fun, I have to say. You're part of this network now by participating. So if these things both speak to you as places of learning, but places you'd like to contribute, we'd encourage you to visit causalpathways.org. Additionally, Fiona alluded to this earlier, but on better evaluation, there is an entire thematic hub on causal pathways. And to reinforce a point Steve put in the chat, it's like we recognize this is a range of methodologies that have some alignment and orientation together, and you can check out a whole bunch of them as well as other things around bricolage design through that page. We hope that as you're leaving, since we're at time, you consider thinking what's one thing you're taking away from this that maybe you want to put into action. Maybe it's telling a colleague about this work. Maybe it's digging more deeply into a certain topic that came up, or something else that we haven't imagined yet. And I know Carolina also put up a final survey. As we mentioned at the beginning of our time together, this is the first time we've done this workshop together. We're constantly, as a network, seeking to continue to learn and improve. So tell us what worked for you, what was useful, and tell us how we can make things better. And last but not least, thank you. Thanks for joining us. We appreciate you sharing your time, your thinking, your imagination, your incredible comments and questions. It's been such a pleasure to get a chance to learn with you today and from you today. So thanks so much, Steve, Fiona, any final words?
Just check out all the resources, and thanks for all the questions. And I'm sorry that we weren't able to answer all of them, but I think you all helped each other out in the chat, which was really nice as well.
Yeah, thanks very much, everyone. Thanks, Carolina and Alison and Fiona and everybody who came.
Have a great rest of your day, y'all.
Bye.
Bye.